Welcome, everyone. In this first part of our lecture, we will begin exploring the topographic anatomy of the foot and ankle. This is an incredibly important region, both anatomically and clinically, and in this video, we are going to study it from both the anterior and posterior perspectives. Let's start with the anterior view, as illustrated in the figure. Here, we can clearly identify the anterior compartment muscles of the leg, particularly the tibialis anterior muscle, which runs down along the anterior border of the tibia. This muscle is a key dorsiflexor of the foot and is clinically important because injury to the peroneal nerve will weaken these muscles, leading to the classical presentation of foot drop. Also visible in this anterior view is the great saphenous vein, coursing along the medial aspect of the leg. This vein is the longest in the body, and it is frequently harvested for vascular grafting, such as in coronary artery bypass surgery. Moving further down, we observe the medial and lateral malleoli. These bony prominences are vital landmarks. Any swelling in these areas is a strong clinical sign of ankle injury, fracture, or ligamentous sprain. Notice also the anterior talofibular ligament, a very common site of injury in ankle sprains. As we follow distally, we can see the tendons of the extensor digitorum longus and the extensor hallucis longus. These are essential for extension of the toes and great toe, respectively, and their prominence is easily noted on physical exam. Their function is critical when assessing neuromuscular integrity of the foot. Now, shifting our attention to the posterior view, the illustration highlights the powerful gastrocnemius muscle with its medial and lateral heads. This muscle, together with the soleus, forms the triceps surae group, inserting into the calcaneus through the Achilles tendon. The Achilles tendon is the strongest tendon in the human body, but when ruptured, it produces a characteristic loss of contour and functional deficit, which is very disabling. We can also see the small saphenous vein, which drains into the popliteal vein, and the peroneus longus and brevis tendons, running behind the lateral malleolus. These tendons are critical stabilizers of the ankle joint, preventing inversion injuries. The posterior view also reveals the calcaneofibular ligament and the posterior talofibular ligament, both part of the lateral ligamentous complex of the ankle. These structures are especially important in sports medicine, where ankle instability is frequently encountered. At the base of the heel, the calcaneal tuberosity stands out. This is where the Achilles tendon inserts, and it forms the posterior anchor of the foot's longitudinal arch. The integrity of this arch is vital. Loss of the longitudinal arch leads to pes planus, or flat foot deformity, which can be either congenital or acquired. Finally, when we look at the plantar surface of the foot, we see the area clinically associated with plantar fasciitis, one of the most common causes of heel pain. The plantar fascia attaches to the plantar aspect of the calcaneus and extends forward, supporting the arch and absorbing shock during walking. Now, let's bring our attention to the clinical applications summarized in the table below the figures. The anterior compartment muscles are linked to peroneal nerve injury and foot drop. Tears in the gastrocnemius often occur at the musculotendinous junction, especially in athletes. A rupture of the Achilles tendon leads to complete loss of push-off strength. Observation of a valgus heel is best done from the posterior view. Swelling of the medial or lateral malleoli is a red flag for fractures or sprains. The longitudinal arch is key to diagnosing pes planus. Pain in the plantar surface is commonly due to plantar fasciitis or ulceration. Prominence at the first metatarsal head is typical of hallux valgus or bunion deformity. And finally, the proximal interphalangeal joints are where hammer toes produce dorsal deformities.
So as you can see, even this introductory topographic view of the foot and ankle gives us not only the map of anatomical landmarks, but also direct insights into common clinical conditions. In the next part of our lecture, we will continue exploring deeper layers and more specific structures of the foot anatomy.